Ontario has become the 5th province to sign on to the Liberal government's $200 billion health accord. It comes a year after the feds offered to boost health care transfer payments to the provinces. Today, the Prime Minister and Premier Ford announced a new deal for our province, $3.1 billion in federal funding to help increase access to primary care and reduce wait times. Matt Ingram joins us live tonight with more. Matt?
Adam, some of the money will be used to hire hundreds of new family doctors and nurse practitioners, as well as thousands of nurses and personal support workers. While the deal is being welcomed by experts, medical associations, and many other industry stakeholders, saying it's still not enough to fix Ontario's healthcare crisis.
A family health team is there to be your entry point into the healthcare system, so you don't need to go to an emergency room.
It's billions of dollars to add family doctors and nurse practitioners to staff an expanded primary care system. A plan these governments say will keep Ontarians from needing to endure long wait times and surgical backlogs in our overwhelmed hospitals.
Today's agreement is so important to strengthening our healthcare system.
But with emergency wait times through the roof, critics are wondering why it took so long.
But I'm going to be zoned in on these emergency departments, and I'm going to work with OMA.
Premier Doug Ford referring to the Ontario Medical Association, who represent the province's doctors. The OMA say the funding will address the most urgent needs, but a more robust long-term funding agreement is needed. Ontario's doctors supported Premier Doug Ford's previous call for the federal government to increase the Canada Health Transfer from 22% to 35% of provincial territorial health care spending. This agreement doesn't reach that number.
The critical idea here is that the healthcare crises that we're experiencing right now, some of it undoubtedly is because of the pandemic effects, but these were a long time in the making.
Dr. Fahad Razak from St. Michael's Hospital in Toronto agrees a longer-term funding solution is needed to address the persistent problem of hallway medicine.
So we're talking about decades of decisions around investments, hospital capacity, training for primary care, which led to a crisis situation, which of course was worsened by the pandemic.
He applauds the support for expanded primary care, and so does the Registered Nurses Association.
It's music to our ears because any high-functioning system has at its foundation primary care.
But Doris Greenspun says the money must be rolled out quickly so more healthcare workers can be hired and retained immediately, likening the healthcare crisis to an illness, where the best outcomes result from quick treatment.
Our system has a disease, and we diagnosed it already. Human resources, human resources, human resources.
The Ontario NDP welcomed the new funding, but question why it took so long to sign, and are concerned the Ford government won't spend it in ways that best serve Ontarians.
Are we going to see most of that money go to rich investor through private clinics?
Ontario's Liberal Party is expressing similar concerns. Leader Bonnie Crombie releasing a statement saying Doug Ford has repeatedly proven he cannot be trusted to support our universal public health care system. During the COVID-19 pandemic, the federal government provided billions of dollars for health care, but Doug Ford parked the funds in the government's coffers. Crombie, of course, referring to a September 15, 2021 report from the Financial Accountability Office that found the Ford government didn't spend several $100 million of its federal COVID funding during the third wave of the pandemic.